Ms. Randon. We so appreciate your prayer and words of wisdom. Thank you from all of our hearts. And good afternoon, everyone. We're 37 strong from all around New Mexico. My name is Valeria Alarcón. I am the Executive Director at the New Mexico Alliance of Health Councils, the backbone organization and ancillary provider to county and tribal health councils. And we want to begin with our land acknowledgement. Our dear friend Sam is queuing us up here. Thank you, Sam. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And with that, dear friends, I want to welcome you again to New Mexico's first Legislative and Health Council Summit. We are so thrilled to have you here today for what promises to be an informative and empowering gathering. This summit marks a pivotal moment in our collective efforts to advance health equity and strengthen community well-being across our state. Today, we bring together dedicated health advocates, legislators, public health professionals, key partners, visionary policymakers, and of course, county and tribal health councils, united by a common goal to create a healthier, thriving, and more resilient New Mexico. So over the next 3 hours, we will learn from our communities, share innovative solutions, actionable solutions, and seed powerful and leveraging partnerships. Your presence here is a true testament of your commitment to making a positive and meaningful impact. And we're so excited to collaborate with you. So thank you again for joining us on this unified effort. And I truly believe that together we can achieve remarkable outcomes for the health and well-being of our communities across the state. So let's begin with a quick little map activity. I would like for you all to turn to your chat. Our friend Anna Horner, our team member, is going to drop a link that's going to open up to a web page where you can identify your affiliation. So if you're here with our state agency, our governor's office, legislators, public health partners, health councils, community members, we would love for you to identify, and we'll take a look and see where you're all joining us from. And Sam, I'm going to need your eyes to refresh, for you to refresh the page here momentarily, and also help me see who's in the room with us in the little pie chart. Of course, we have our 33 counties, and the green sections here too are representative of our tribal communities around New Mexico. Sam Henning, who is our communications lead at NMHC, if you can share with us, who do we have in representation? I can't quite see the fine font in the pie chart.
We have a pretty great equal representation from government employees, health council members, some of our partners, as well some of our tribal government representation as well. A lot from the middle and west side of our state.
Thank you, Sam. Thank you so much, everyone, for taking time to include your affiliation. And of course, let's see, Sarah, if you can maybe refresh the link. We have a couple of people whose the link is not working for, but we invite you to please include in the chat your name, affiliation, and what region you're joining us from our beautiful state here in New Mexico. We are now 46 strong. And then with that, I also invite you, because this convening is obviously recorded. We're going to be sharing it back with all of you with the slide deck, handouts, and everything, to please utilize the Q&A option for including any specific questions related to the programming, the presentations, the interactive activities that we will be sharing with all of you. And Sam, the yellow section, now that you've refreshed, who's the yellow representation here, predominantly here?
That is our partners and collaborators.
Oh, welcome, partners and collaborators. It takes all of us, right, working together, state agency, government, legislators, care management organizations, county and tribal health councils, county commissions, and the list goes on, a nonprofit sector, of course. So thank you so much for taking time to help us see who's in our room with us. So Sam, let's move over to the purpose of the summit. And as mentioned before, these really serve as pivotal opportunities to learn from communities. You know, when we think about the words health equity, what is at the heart of health equity, of course, is accessibility. And just as equally important is representation of the diverse communities across the state. And so that's at the heart of convening these summits, to really center the voices of our community members via county and tribal health councils, and to engage in solution-driven conversations to address obviously present issues related to population health, social determinants of health, health barriers, so that we can really actualize health equity for all in New Mexico. And so, moreover, by aligning community priorities, right, through the collective efforts of New Mexico's county and tribal health councils, we aim to co-develop a map, a roadmap with statewide partners that reflect community values for sustainable change in a healthier New Mexico. So we're going to move over to celebrating our dear friend, Representative Anthony Allison. I want to say that on behalf of New Mexico's county and tribal health councils and the New Mexico Alliance of Health Councils, I want to express our deepest, wholehearted gratitude to Representative Allison for his unwavering dedication and effective championing on behalf of health councils. Representative Allison, your commitment to improving community health and advancing health equity has made a significant impact, empowering us to better serve our communities across the state. And because of your dedication and steadfast leadership, we are here today. County and tribal health councils are here today because of you. Representative Allison has worked tirelessly alongside co-sponsors to ensure funding allocation for health councils for this year, FY 2025. So a big thank you to Representative Allison and co-sponsors, Representatives Thompson, Armstrong, Lujan, Dente, Johnson, Chatfield, Herndon, and Senator Stefanix. And of course, our many thanks to Governor Grisham and Representative Small and members of House Appropriations and Finance and our partner, NM Department of Health, DOH, for working together to secure this one-time funding for health councils so that they may continue to serve communities as they have, guess what, friends, for over 30 years. So Representative Allison, thank you for your heart-driven vision, your spirit to public service, which has been so instrumental in driving legislative priorities that align with creating meaningful change. We are inspired by your passion and ever so grateful for your continued support. And so together we're making strides, my friend, for a healthier New Mexico. Thank you for all that you do, and know that we all wish you a most restorative and fun retirement. And we are so going to miss you, my dear friend. And so with that, I'd love to introduce Representative Allison, who's the Vice Chair of Agriculture, Acequias, and Water Resources, and a member of House Appropriations and Finance Committee. Welcome, Representative Allison. Over to you, my friend.
Thank you, Valeria. Thank you for the invite. And I am among friends, among very, very compassionate, loving people. I am Anthony Allison. Well, I should say good afternoon first. I am Anthony Allison, the current New Mexico State Representative from District 4, which is the western 2/3 of McKinley County in Northwest New Mexico. I represent 9 Navajo chapters and the small communities of Fruitland, Kirtland, Waterflow, and Northwest Farmington. This is my 3rd term and the final year as a legislator. Before becoming a legislator, I was an open pit coal miner. I was a journeyman electrician by trade, but most of my years has been in management. I have a deep appreciation and love and respect for all people that work in healthcare, education, public safety, and the environment. I always say that these people have a lot of heart, a lot of love, and a lot of compassion to do what they do. For me to describe Valeria would be, I would say she's 5'7" of heart. It is not easy to deal with healthcare or education or public safety. You have to have a lot of heart to do what you guys do. So I appreciate you for that. Since 1991, health councils have been the foundation for New Mexico's public infrastructure at the local level and within the public health statewide system. In 2010, health councils were defunded due to a critical budget shortage in New Mexico at the time. However, current budget surpluses provide the state of New Mexico with the opportunity to restore adequate funding and leverage New Mexico's local health councils. Investing in health councils improves health outcomes and drives health equity efforts across the state. That is just a brief introduction that you will probably hear time and time again from Ms. Alarcon and Ms. Antonio this afternoon. I have been in the New Mexico State Legislature since January 2019. One of my first bills was introducing House Bill 67. The title on that was County and Tribal Health Council Funding, with my esteemed co-sponsor, Representative Liv Thompson. The bill asks to make an appropriation to Department of Health to fund county and tribal health councils. The amount we asked for was $1 million for expenditures in fiscal year 2020. While it received a due pass from the Health and Human Services, it did not make it to the other committees. And eventually, before it became law, it had died. In that same session, we tried again with House Bill 137, County and Tribal Health Councils Act. This bill expended more by enacting the County and Tribal Health Councils Act, repealing the Maternal and Child Health Plan Act. This bill was more successful and was passed and signed by the governor. The goals of the bill were to improve the health of all New Mexicans by encouraging the development of comprehensive community-based health planning councils to identify and address local health needs and priorities. It also said residents of a jurisdiction may create a health council to carry out the provisions of the Act. Other functions that was listed in that House Bill 137 was prepare a community health plan, plan and include assessment and inventory of health resources, identify priorities. It also lined out the strategies and resources to address health priorities. It also asked to monitor health and health programs and services to identify gaps and reduce potential duplication It also asked to collaborate with other entities to develop programs, networks, partnerships, and coalitions to improve health. And finally, it asked to facilitate communication with local jurisdictions, state agencies, and other entities. It also directed the Department of Health, and it was outlined as, in consultation with health councils, develop benchmarks, expectations, and mechanisms to ensure the long-term viability of health councils. In collaboration with universities, other state agencies, other state public health agencies provide training, technical assistance, and other support to health councils. It also asked the Department of Health to develop a system to evaluate effectiveness of health councils and necessary data collection. And it was also tasked with administering funding. While this bill, HB 137, did not allocate any funding, it was still signed into law. Health councils played a very, very important and critical role during the COVID pandemic of 2020. They did and are still doing more than what local clinics are doing. For these reasons, I strongly support the continuation of health councils. In 2023, we introduced House Bill 49, County and Tribal Health Councils funding. In that, we ask for an appropriation to the Department of Health for health councils to operate statewide. What we asked for was $5.25 million to fund and support health councils. And we asked for an additional $500,000 to contract with a nonprofit organization to provide training, technical assistance, and other supports. Also, assistance of a system to evaluate effectiveness. Finally, strengthen community-based health planning and self-determination. This bill passed 2 committees, but was never heard before HAFC, as we were told an amount was already allocated to the Department of Health in HB2. Although the bill eventually died, it still was included in HB2, where an allocation of $3 million was made. This is just a brief history of my involvement in promoting health council bills. As we all know, the importance of health councils, so we should not rest until the funding becomes recurring, so that we do not have to introduce legislation every time we meet. It should be a recurring thing, because health councils, in a sense, save the Department of Health and will also save the new Health Council Authority. So I'm asking my colleagues and constituents to continue supporting this. This is just a very brief introduction of my involvement with health councils. The person that helped me the most, I would say, would be my co-sponsor, Liz Thompson, in the initial introduction of House Bill 67. Other legislators have asked to be put on the bill to support it, but we did not really hear that much from them. And I believe that, for example, my replacement in the legislature will probably support this as much as I did, if not more. But I think there's another legislator who just recently won a seat. She is from the To'ahgee area, and that is where one of the health councils is located. I believe that we should incorporate the services of the new legislator in that area. So I am very proud that I worked along Ms. Alarcon and Ms. Antonio to really promote the health councils as much as they did. I just introduced the bill. They did all the hard work of promoting and keeping this going, along with another colleague from, I believe it was Jemez Pueblo, Mr. Tony Yepa. So I appreciate everybody that has worked with me. And I want to thank you all for your hard work and continuing to do the hard work. I do not think that I will be able to spend the next 3 hours with you, but I know the Health Councils is now in good hands and will continue to be in good hands. Thanks to Ms. Alarcon and Ms. Antonio. I mentioned those names because they are the ones that work very, very closely with me. And when we were doing the bill introductions to the committees, they were my key supporters and expert witnesses. So I had Geraldine and gracias, Ms. Alarcon. So I'm going to return this video back to you, and I thank everybody to continue working hard and make it all a safe day. You cannot just have it. You've got to make it a safe day. Thank you.
Thank you so much, Representative Allison. It has been, I know both Geraldine and I, true honor to work side by side with you. This is our Share Lives mission to make sure all 2.11 of our New Mexico, population across our beautiful state get to live a happy, healthy, and thriving life. And we have the ability to do that. We have the expertise, we have the resources, we have the willpower, we have the deep dedication, and that is reflected in our leadership, such as in yourself, Representative Anthony Allison. Thank you for all the ways you have shown up for our state, for your district, and thank you for your deep dedication to the health and well-being of our communities. From our hearts to yours, thank you, and we will so miss you. And with that, my dear friends, we're gonna go over our agenda for today. I do have a little disclaimer, as Representative Allison touched on some of the elements of HB 137, which defines the role and function of county and tribal health councils within the public health infrastructure. I want to just say that, some of the presentations that we're about to dive into are a bit data centric, content centric, and of course, it's indicative of the depth and breadth of the work, the vital work and instrumental work of county and tribal health councils. And so we will be sharing the slide deck post the summit so that you have time to dive deeper into the content. And of course, Geraldine Antonio, tribal liaison, myself, our team is readily available during the summit and post the summit to answer any questions that you may have. Again, I invite you to drive your questions towards the Q&A feature in the webinar so that we can answer them accordingly. And so we are going to sort of give you the lay of the land of who health councils are, a little bit of, bit of their history, and also how they're prioritizing community health needs, community health priorities, advancing health equity, and seeking to improve population health and wellness with key partners across the state. We're also going to highlight all the ways in which they are deeply collaborating at the local and systems level. It takes all of us, right, to serve our communities. We're going to be hearing from our community members as well. And then third, we're going to walk you through a very dynamic presentation that shows how deeply aligned the work of health councils are with governor priorities, with legislative priorities, with state agencies like NMDOH's North Star, right, of becoming the healthiest state in the country by 2040. We're so deeply aligned with that work. And then we're going to hear from county and tribal health councils themselves about their work on the grounds. And then we're going to invite everyone, all 53 who are here today, thank you, to interact with us in defining a pathway forward. So our dear friend, Sipora Panish will be facilitating that process. So let's begin with who New Mexico's county and tribal health councils are. As you know, they've served communities for over 30 years. So with that, I'm going to pass the baton over to Geraldine Antonio, NMHC's tribal liaison.
Thank you, Val, and welcome everyone. So again, just going to go ahead and note that A lot of this information is context heavy, but we will share these slides after today's summit. And so first, just going to mention here that we are a statewide network of 33 county health councils, meaning there's one health council in every county in our state. And in addition to that, there are 10 tribal health councils. And so happy to announce that on the right side here, listed is all of our tribal health councils in New Mexico. 9 of them being Pueblos from the Pueblo of Acoma, Cochiti, Nambe, Picris, San Ildefonso, Santa Ana, Santa Clara, Santo Domingo, and Tesuque. And then our Navajo community from the Canyoncito Band of Navajos, also known as Tohajale. And so in addition to that, we have some potential new tribal health councils from the Pueblo of Poake. And so it is exciting to see this expansion of health councils happening statewide. On this slide here, I'm just going to quickly note that there are state statutes. And so these here all support our county and tribal health councils. Under House Bill 137, specifically, this outlines the roles and functions of county and tribal health councils. And so thank you to Representative Allison. He made my work a little bit easier on this slide because he actually gave a full description of all of the county and tribal health councils functions. To summarize that, it's very specific to community-based health assessment, planning, prioritizing, monitoring health services and programs, and collaboration. And so that is all under the 2019 County and Tribal Health Councils Act. And so to read more about their functions, we're going to go ahead and drop in the chat a link to House Bill 137. The State Tribal Collaboration Act. And so why this is important for our tribal health councils. The state tribal collaboration is important because it mentions how state agencies should collaborate with the tribes, pueblos, and nations in New Mexico. And so this is vital for the work of our tribal health councils in a sense that we want to be sure that they can maximize the expansion of services and resources and do this in partnership with the state agencies and their tribal liaisons. And so I'm so very grateful that the NMDOH Tribal Liaison has been able to meet with our tribal health councils on many occasions and listen to some of their needs and be of support to them. Under House Memorial 2, this here was a task force created in partnership with the Secretary of Health from DOH. And so with the task force, they were tasked with providing recommendations on how to improve the state's public health infrastructure. And so to summarize that, why this is important, there were 5 top key recommendations. And of the top 5, county and tribal health councils were of the top 5, specifically to adequately fund them and to support our local public health infrastructure by investing in county and tribal health councils. And so these are all supporting legislation that support our county and tribal health councils statewide. And so on the next section here, we are just going to touch a bit about the partnership between the Alliance and NMDOH. And so there's sometimes some confusion about who we are and how we support health councils. And so on the right here, I'm just going to start with the New Mexico Department of Health. Number one, they are a state agency. And so specifically, their roles in supporting health councils at this time is very specific to the community health assessments and community health improvement plans, providing technical assistance through their health promotion teams. And in addition to that, other technical assistance as outlined in House Bill 137. And so they support county and tribal health councils. In addition to that, the Alliance, our team, is a nonprofit. And so we support county and tribal health councils through ancillary support. And in addition to that, we are doing so much advocacy around health council funding, as noted by Representative Allison. And so that's going to be our big push this year and part of the reason that we are having this summit today. In the middle here is an infographic. I think Val had noted the North Star by 2040, which is DOH's goal to be the healthiest state by 2040. And so at the center and heart of that is our county and tribal health councils. And I feel like this infographic depicts how important and vital our health councils are in New Mexico. And through this, county and tribal health councils have been able to develop community health improvement plans, which then inform DOH's strategic plan. Not only that, but also support their public health accreditation board requirements. And under that, more importantly, these community health improvement plans will inform the state health improvement plan. And so you can see at the heart of this is county and tribal health councils, and in alignment with that are CHIP priorities that align with the governor's health priorities. In a sense, to reach the North Star by 2040 is something that cannot happen without investing in county and tribal health councils. And so, yes, we both support county and tribal health councils, but ultimately they are at the heart of our state's public health infrastructure. And on the next slide here, oops, no worries there. We're just actually going to do a very quick poll just to engage all of you here. And so the question is, do you know who your health council is? And so I know I gave a quick summary, but just to see, engage the room, you know, who's new, who's maybe already part of the health council and knows the functions. And so as we're looking here, we'll go ahead and share the results here in a bit. We've got about 20, 30 people who've answered. So I'll give it a second. So this is awesome. So we're going to go ahead and just quickly share. 81% of you know who your local health council is, and 20% don't. And so this is awesome, because I hope the overview I gave you some context. I know that we had to breeze through some of the information, but if you have any questions, I am more than happy to connect with you or help you connect with your local health council so we can start building those partnerships and relationships. And I'm going to just go ahead and hand off to Val here just to give some context to some funding that we recently had.
Thank you, Geraldine. And this references Representative Allison's note around health councils in terms of the funding history. They were defunded in 2010. There's been various degrees of funding, but not enough to, you know, really leverage them for success within these pretty significant role and functions that they carry out. And so due to COVID, right, it was all hands on deck, public health crises around the world. This is where state funding, CDC funding, WK Kellogg stepped in, our philanthropy partner, and funding was made possible for the first time in a more sustainable manner for health councils during the pandemic. And then, of course, year one of the pandemic, all of the efforts were focused collaboratively with state agencies and key partners, care management organizations, DOH, focused on emergency response due to a pandemic, COVID-19. I just want to highlight here that health councils were able to reach well over 345,000 New Mexicans. I think that comes out to 16% of our population. Again, it takes all of us, right, to serve our communities. And as you can imagine, county and tribal health councils knowing their communities so intimately. They know their elders, they know the most most rural parts of their communities. They know how to reach and serve their community members alongside with key partners. And so we've learned a lot through the last, these last 3 years with COVID. I think it made the invisible visible around inequities, disparities in our public health system, not just in New Mexico, right, but around the country as well. So there's a lot of knowledge there that we can utilize to inform how we get to improve public health systems in New Mexico now with all of our partners, state agencies included. Year two, very much focused on vaccination events, preventive education, assessing, having the capacity, right? Being able to hire a part-time coordinator, for example, and have the capacity to conduct community-based health assessments, to identify community health priorities, right? And have the resources available to them to access technical assistance so that folks have the resources available to excel in their work. And then year 3, which is the year that we've just completed, health councils have completed their community health improvement planning process, which informs the statewide health improvement plan itself. And now they're in their implementation phase. And this is something that Geraldine is going to go into a sequence of what that process looks like for health councils. So we've been able to actually, build health councils for the first time in terms of their capacity and function in the last 3 years. And now New Mexico has the opportunity to really leverage this critical system for success in service of community members and as a strong collaborator, right? To have the capacity to continue to be a strong collaborator with our state agency partners, care management organizations, nonprofits, counties, and the list goes on. So as we move to the next slide, this goes into more detail around the ancillary services that we provide, NMHC provides for health councils. I'm not going to go into detail here. We'll share that with you post the summit. But the next slide, we want to do another poll. We would love to hear from all of you as to how many of you attend your local health council's monthly meetings. It'll be great to get a sense, and it's looking like, as this thing is reloading very, very fast, 63%, 64%. So it looks like we have around 59% who have attended their local health council's monthly meetings. 15% haven't. I hope this information that we've shared so far and that we will continue to share here in this presentation will inspire you to join your local county and tribal health councils monthly meetings. This is where we get to work together, take action, and serve our communities. So I'm going to pass this over to Geraldine Antonio.
Thank you. And so very quickly on the question around attending a health council meeting, just a few tips. A great way to join a meeting is to reach out to the health council coordinator, and again, just build that relationship, let them know you're interested in attending. And if it's a tribal health council, maybe a little bit different. Our tribal communities, some of their meetings are closed off to the public, but they are definitely open to presenters and different forms of presentations at their local tribal health council meetings. So just a little quick side note on that. And so this next section here, we're just going to go into the CHA-CHIP. And so many acronyms if you're in the health council world. CHA meaning Community Health Assessment. CHIP is Community Health Improvement Plan. So if you hear us saying that, that's all that we mean. On this next slide here, so these next few slides here are data heavy, but what we're going to focus on this one here is just an overview of this 24-month process. Over the past 24 months, health councils went through a 5-stage process. Health councils were the lead in convening community, assessing community needs through different forms of like surveys, forums, interviews, other forms of data collection. They also were the lead in planning and prioritizing. And so that meant filling out an action plan for their community. Collaborating with partners, I think Val had noted that, which is really key in carrying out a lot of these initiatives. And then last, implementing. And so health councils are currently in implementation phase this year. And so this is really important so that way the Alliance and NMDOH Health Promotion can further support the role of health councils with evaluation. And so evaluation happens with health councils submitting monthly reports on their health council initiatives, and then also submitting quarterly reports on their progress on their CHIP action plans. Again, we report all of our findings to the governor's office and legislators. So it's really key for the legislative session in order to advocate for funding for the next session. And so the next slide is just a statewide overview of community health improvement plan priorities. As you can see, no red alert here. Not news to everyone in New Mexico, but we are seeing health councils prioritizing behavioral health. And this is a statewide, at a statewide level, both county and tribal health councils combined at 55.6%. Reporting behavioral health as their #1 priority. And so when we say behavioral health, all we mean is co-occurring substance misuse and mental health. And so I just want to note too that, when we think about health, it is not compartmentalized. So if we look at behavioral health, there's definitely some intersection with access to health care, also to affordable housing. In addition to that, right, if you want to expand on that, violence prevention, access to healthy foods. And so you can see that there's so many intersections to health when you look at this graph. And so last, I just want to point out that all of this information is community-based. So health councils have been able to go into their community, survey them and assess them and get feedback on, through surveys and different forms of data collection. And so this tells you that this is what community is telling health councils. And this is therefore informing our state health improvement plan for New Mexico. And so I think that's really key about this work is that health councils are serving as that liaison for community to state agencies and getting the information directly from community members. On the next few slides here, we just wanted to break down health priorities by regions. And so, I think this is important just to give everyone a second here, but definitely take a look at some of these graphs, depending on which region you're from. On the left side here, all we're focusing on is our tribal health councils. You can see tribal health councils, there is the #1 focus for behavioral health, but the next priority here is diabetes prevention coming at #2. And third, elder and aging care and healthcare services. So this is to give a little depiction of our tribal health councils and their focuses. In the metro region, covering Bernalillo, Sandoval, Torrance, Valencia, and our tribal health councils, Tohachile, Cochiti, Pueblo, and Santo Domingo, Pueblo. This is, again, #1 behavioral health being a major priority. If we go to the next slide here, we'll get to look at the Northwest and Northeast regions of New Mexico. For the Northwest, you do see a little bit of change here in priorities in this region, specifically focusing on healthcare services. And second to that is behavioral health, actually all at 20%, right? Behavioral health, affordable housing, elder and aging care. On the Northeast side, by a landslide, behavioral health being #1. And so I hope you all got a chance to look at which counties you're from and to see the priorities, in your region. In the next slide, again, we broke it down by the Southwest and the Southeast region, both Southwest and Southeast, #1 being behavioral health. You do see here in the Southeast, there is a lot, second to behavioral health, there is some focus on violence prevention. And so for that specifically, there's been a lot of focus on gun and violence prevention. And so it's really neat to see each region's tailored to some of the specific needs in the community. The next slide here, we just break it down by county and tribal health councilship strategies. And so you can see here on the county and tribal side, we just wanted to show the differences and also the ways that they are very similar in the ways that they are carrying out some of their initiatives. There is correlation between information and education. That just means that some health councils are focusing on updating and sending out resource directories, or maybe doing QPR trainings or mental first aid trainings, and disseminating information on social media, newsletters, podcasts, and other methods. There's also correlation between access and services. And so all that means is their health councils have also been focusing on referrals and linkages, and also that continuum of care to make sure, when someone's been referred, that the care is followed up and followed through as well on that end. In addition to that, there is also some linkage between partnerships, which is really key in carrying out a lot of this work, and policy. When we say policy, there is a lot of work happening, for example, in the tribal end, working with their local tribal leadership on many initiatives or different policies that are affecting health outcomes. And so this just gives a little statewide depiction. Now that they've identified priorities, what does it look like as they implement these and their strategies statewide? The next slide here is a recent initiative. It's not really depicted on the community health improvement plans, but this is a separate grant that health councils receive called the Climate Change Health Impacts and Community Action. There's a lot of focus on studying drought-related policies and the impacts of that. And so through this grant, health councils have been able to assess their capacity to look at the impacts of policy, also to increase community engagement around this topic. And then lastly, how to utilize data, translate it, and then access data. And so we have both county and tribal health councils that are part of this grant here. What's been identified through these 5 communities is the top priority being public water systems. And so some of the activities under this so far have been looking at, drinking water violations and notifications. So how do we view how do we notify the public that their water system has been contaminated? And so that's one of the initiatives. Second is doing climate change education through different forums like the media, podcasts, and educational materials. It's really awesome that they also developed a little coloring book for the youth to educate them about climate change health. In addition to that, looking at drinking water access as a human right. Some health councils are focusing on greenhouse gardens for their senior centers. And then last, there is another initiative around installing solar pumps to provide water for livestock and wildlife. And so this was just to give you an high-level overview of some of the impacts health councils are making, priorities statewide, and then some focus on climate change health here, which is really important. And on to the next slide. I know we got some context on if you know your health council or if you attend health council meetings, but we're going to go ahead and end this section here with a third poll. How would you like to be involved with your health council? And so if you list other ways, please be sure to just drop that in chat so we can go ahead and keep that in mind. We'll give it a second here for people to go ahead and answer the poll. Okay, so it looks like options were attend monthly meetings, join an action team, attend health events, subscribe to the newsletter. And we'll go ahead and share the results here. So it looks like attend health events was at 70%. 63% attend monthly meetings, join an action team. And so depending on the health council, some health councils may have separate subcommittees, and so they will have specific focuses. So that would be considered action teams or subscribe to the newsletter. And so on that note here, on the next slide, there is a QR code, but we're also going to post in chat. Ways to get involved with your health council, right? Attend those meetings, join community events, join their newsletters, any type of communications that you want from your local health council. On this slide here, the Alliance has been able to develop health council web pages. And so you can access their mission and values. You can see their CHIP priority. You won't be able to see their CHIP action plan. I will tell you that now. We still need to go through an approval process for both county and tribal health councils to share that publicly. But if you get a chance to attend their monthly meeting, that is probably something that is already on the agenda. So you probably get to learn more by even engaging in those monthly meetings. In addition to that, you'll see their fact sheets and then a contact information for the health council coordinator. So yes, please check out our web pages and you can connect with your health council coordinator and at your local health council. I'm going to go ahead and end my section here, but we're always happy to chat with you offline. If you have any questions or anything specifically that you want to ask, that's what I'm here for. And so I'm going to go ahead and just hand back off to Val.
Thank you, Geraldine, for such an engaging and thorough presentation about the vital work of county and tribal health councils, and all of you for your attention. I know it's a lot of information to take in. And now please join me in welcoming Cabinet Secretary Patrick Allen from the New Mexico Department of Health. Secretary Allen and his team oversees the New Mexico Public Health System, statewide epidemiology and emergency response services, state scientific laboratories, services for New Mexicans with developmental disability, statewide health facility regulations, and the operation of 7 residential care facilities. And I know so much more. Thank you so much, Secretary Allen, for joining us today. We're so happy to have you with us.
Well, thanks very much for having me and for the opportunity. This week, it feels like all we do is emergency response. We, of course, we've got the fires down in Ruidoso that we were actively working on last week, supporting evacuation centers, especially at the convention center in Roswell. All kinds of support around there. We had people looking for how to get vaccines filled, those kinds of things that we've been helping with. And then over the weekend, we had major flooding in a variety of places in the state, but especially up in Las Vegas, it caused our local public health office there to need to be closed. And we've had significant impacts at the Behavioral Health Institute, which is a large complex facility, and we're working on issues there. Everyone is still at the Behavioral Health Institute and safe. There's been rumor about evacuation and those kinds of things. That has not happened. We don't anticipate that at this time, but it's been a lot of emergency response over the last couple of weeks. Also, you mentioned health improvement and developmental disability supports. Those will be part of the Department of Health for 4 more days, and then they will move over to the Healthcare Authority. And maybe I should just touch quickly on that. The Healthcare Authority is the new name, but not just a new name for the Human Services Department. It's really an effort by the governor and the legislature to create a new kind of an agency for New Mexico that consolidates healthcare purchasing and regulation and all the work that we do around getting access to healthcare for people, to really consolidate that work, policymaking, purchasing, and regulation into one place, to use the leverage to be able to get better outcomes for New Mexicans. And sometimes when you hear consolidating purchasing for better outcomes, you think, well, we're going to try to drive down provider rates. That's not the point. The point is to get better outcomes. Our agency's long-term goal is for New Mexico to become the healthiest state in the country by 2040. And there's a lot that goes into that. That's the quality of care that we receive, but it's the 80% of our health that doesn't have anything at all to do with healthcare and the healthcare system. So that's really what the creation of the Healthcare Authority is about. We are really committed to that 2040 goal. And right now we're doing work internally to try to identify, if we're going to make that happen, what's it going to look like? Some of it is sort of internal or external stuff that's just how we get our work done. You're hopefully seeing some of the benefit of that now. We're in the last stages of figuring out the scope of work and contracts for health councils. I look at my watch and I see that we're doing that in June this year rather than doing it in November or December. And so I think we've made some great strides in terms of our own business processes, which are part of what we need to work on. We need to work on ourselves as an organization in terms of our organizational health and those kinds of things. And so we're doing that work. But we're also looking externally at how do we need to drive health in New Mexico. And this is really, I think, where health councils come in and are a vital partner for us. We've got some internal working groups looking at basically health outcome metrics. We've picked a national ranking out there, America's Healthiest States. And they track a variety of metrics. And so we're looking at those, and we've identified 3 clusters that we think are important. We've identified maternal child health, we've identified behavioral health, and we've identified preventable death as 3 areas that we really think that we, together with partners like health councils, can make a big impact on. And some of those things obviously overlap with each other, right? If you look at behavioral health, that gets into things like addiction. overdose and alcohol-related deaths are a part of preventable death. Addictions amongst pregnant people are where maternal child health and behavioral health overlap. And so you can see there's a lot of things that are intertwined there, but that really is the idea, is how can we identify what are the things that we want to make progress on immediately that we think can move the needle in terms of New Mexico moving up from what is currently the 43rd healthiest state in the country to ultimately being number 1 by 2040. Really extremely happy with the work that we've been doing together with health councils. Val and her team at the Alliance did an outstanding job this last legislative session, actually really completely on their own shoulders, working with you all to get a package of funding through by the commitment of legislators, and we're now working on that scope. Really key to that scope is being able to go back to the governor and to the legislature and demonstrate how are New Mexicans healthier for the investment that they've made in health councils. And that's why I think this scope is so critically important. I'm committed to being able to wanting to carry the ball and get significant funding for health councils built into our base budget going forward, so that we've got some more certainty at a higher level than what's currently there. But we really have to work tightly in partnership with each other to be able to do that, because we have to be able to compellingly answer that question: how are New Mexicans better off? And so that's where you're going to see things in the scope of work that get to issues like referrals for services and trainings delivered and those kinds of things, to really be able to show, aside from the really vital work of organizing and identifying priorities and communicating those priorities, that your connections and networks and relationship with people on the ground really shows up in terms of how people access services and how we're able to project out the work Department of Health does into communities. So really appreciate all the work that you do. I'm really glad that we're at the place where we are now of just about having those contracts pinned down so that we don't have a bunch of uncertainty like we did last year. Val, if there's time for it, I'd be happy to take any questions or see if there's anything on anybody's mind.
Thank you, Secretary Allen. And yeah, let's see, Anna, if you can help me facilitate the Q&A, if there are any questions coming in from our guests here today for Secretary Allen. Let's see. Okay, so we see none at this time, Secretary Allen, and so grateful to be in partnership with you and aim towards, making 2040 North Star a reality for all of New Mexico. We're right by your side on that goal.
Well, thank you, Val, for your help. Thank you for the work that you have done tirelessly around health councils last session and before, and I know going forward, we wouldn't be where we are without you and your work. So thank you.
Likewise, my friend. We will continue to work together in partnership and service of New Mexico, which is deeply honored to be at this space with you and our partners at DOH. So thank you for your time today. I recognize you're very busy too. And sending lots of prayers to our friends around New Mexico who are being affected by the fires. May everyone be safe, and may these fires cease ASAP. We have a message here from Debbie Ortiz, Torrance Health Council. Secretary Allen, thank you for your commitment to securing recurring funding for county and tribal health councils. It is so deeply appreciated.
I appreciate that. Thank you, Debbie. All right, I'm going to get back to.
Yes, thank you. Thank you. All right, my dear friends. And on that note, it takes all of us working together in service of our communities. We are stronger together through our collaborations. And so with that, I want to turn to a very dynamic, a very informative, high-level slide that our dear friend Emily McGray from the Public Health Institute took time to curate for us. So on the right-hand side, you see the New Mexico map, 33 counties. The blue dots are the tribal health councils. that we're working closely with at this time. And on the left-hand side, you will see in segmentation the various types of collaborations that health councils are partnered through, either leading or participating, whether with state agencies, as Secretary Allen noted. Health councils are instrumental in the work of the context of public health infrastructure. Of course, we're exploring partnership and collaboration opportunities with the new healthcare authority. Kira Ochoa, we're so grateful that you're here today, Deputy Secretary of the new Healthcare Authority, Aging and Long-Term Care Service, also local partners, whether it's county commissions, our public health offices, higher education like UNM and MSU, of course, our statewide resource directory, Share New Mexico, sharenm.org, our tribal nation partners, the All Pueblo Council of Governors, Navajo Nation, the Hajili Navajo chapter, and the list goes on, my friends, on the Tribal Health Council partnerships. It's quite the roster with Aztec and Indian Affairs and many others. So I invite you, as we share this slide deck, to take a look at this list in detail. And of course, we do have a 15-page overview of these collaborations that give a little bit more context that we'll be happy to share with you post the summit. And then if we move on to the next slide deck, and to centering community voices from across New Mexico, I'm going to turn it over to Sherilyn to queue up our Community Voices video.
Perfect. And Val, just go ahead and give me a thumbs up if you hear the video as soon as it starts.
Our Rio Arriba Community Health Council means a great deal to me because it is an opportunity for us to collaborate, come together, work on the social determinants of health in our community together, because a lot of these social problems and social ills that we have are complex and they're tough to solve. Not one organization or agency can solve them. We got to solve them together. So it's an opportunity for us to come together, leverage our resources, and try to make an impact the best we know how.
So when I go to the Health Council, I am reminded that there's a team, that there are other people who support the work I do. There are people who need my support in the work that they do. And that moral support may be one of the most helpful things the Health Council gives to me. If the Health Council did not exist, I honestly think I would have burned out in my work years ago. It's hard to work in isolation. It's hard to work without perspective. It's hard to work without friends, partnerships, relationships of other people in similar fields working right along beside us. And that, I think, is the best thing about the Health Council. Can't imagine not having a very strong, robust, powerful Health Council. Can't imagine not having a meeting, the Health Council monthly meeting to go to every month, where I know I'm going to get uplifted, where I know I'm going to be energized in my work to continue working as part of a team towards better health outcomes in our beautiful Rio Arriba County.
And what it means to me to be part of this organization is to be surrounded by peers and colleagues who are as passionate and dedicated as I strive to be, to provide for this community and to see this community rise.
Health councils are very important to me and the work that I do. At my center, we strive to include medically underserved and diverse populations in health research. Health councils allow me to meet with community members, network, create meaningful engagement, and build trust with individuals in efforts to increase New Mexican representation in health research. The data that comes out of research informs our policies, education, medical practices, and everyday lives. So it's really important that New Mexican voices are included, and health councils are the conduit to make this happen. I'm so grateful for health councils and would not be able to do my work without them.
Hi, we're the Granbury Pueblo Health Council.
We were established in October 2021.
We consist of all staff from each department to work collaboratively together.
Some of our priorities include the direct service directory, staff and community trainings and prevention services, and run referral system service programs that can be accessed by internal and external partners.
Based on our data from our 2023 Community Health Assessment, we have implemented AA 12-step programming, yoga classes, youth reading program, and computer literacy classes. All this is due to County Tribal Health Council funding.
Hello, my name is Kristen Trujillo. I'm the Executive Director of the San Martin de Porres Soup Kitchen located in the beautiful Espanola Valley. We have been serving those in need for the past 32 years since July of 1992. And we would not be able to do what we do without the support of our community members. And this is why I feel it is so important to be part of the Rio Arriba Community Health Council. I feel it has greatly strengthened our collaboration efforts and partnerships with fellow nonprofits and agencies, other agencies, and community members. Not only does the soup kitchen just focus on addressing food insecurities, but many of our clients come to us needing additional services, such as behavioral health, transportation, housing, medical, and through the partnerships that we've built with other members of the Community Health Council, I'm able to refer my clients to these other agencies and get them the services that they need.
The Quay County Health Council has conducted complimentary training sessions on administering Narcan and rescue breathing, provided education on opioids, distributed Narcan kits, medication disposal bags, and free lock boxes for secure medication storage to all school districts in Quay County. This initiative has reached 201 staff members and teachers from kindergarten through the 12th grade and Head Start. The classroom setting is crucial for kickstarting community impacts and prevention efforts, with effects ranging from short-term to long-term. By aiming for positive community-level changes, we can equip our youth with the skills needed for a healthy and happy life.
Hi, I'm Stacy Cox, and I run Public Health Institute New Mexico. Please join me in supporting and celebrating our local health councils and the New Mexico Alliance of Health Councils. If you live in New Mexico, you know we need local voices on the ground, helping us put together a continuum of care, helping us really understand local issues, and helping push those issues up to problem solvers in Santa Fe. As a native New Mexican who grew up in Roswell, spent 20 years in Las Cruces, and is now in Silver City, I can tell you, you don't understand a community in New Mexico until you live there. Thank you so much for your support, and please let us know what we can do for you.
I have been a member of the Quay County Health Council for over 30 years. The council was important enough to me that upon my retirement, I accepted the job of council coordinator. One of the biggest benefits of the Quay County Health Council is the sharing of resources. Hearing from organizations about all the services they offer helps our members link their friends and neighbors to needed services. In addition, we bring many groups together to work on community-identified issues, stretching resources, and building networks.
Hi, I'm Loretta Huerta with Road to Recovery. How my health council has helped me is providing lots of resources. I like that there's so many community agencies that get together on a monthly basis. We share ideas, they listen to our plans, and we just become stronger. Having a health council makes the city vibrant, exciting, and provides so many good resources for families. And more importantly, because children are our future, I know that our health council focuses on veterans this year, but children are important too, and that's why our work together is so important. Thank you for your support.
And the Health Council has been important to my club because it's allowed us to participate in community events and provide community service for those times. It's also given my kids the opportunity to do some really fun things like to make recipe videos, which are on our Facebook page, and I invite you to go and look at those as well. So the Health Council is really important because it lets my kids know that even at a young age, they can make an impact on their community in positive ways. And I would invite you and encourage you to join your health councils wherever you are and make a difference in your community too.
Our Chaves County Health Council is an integral partner with our efforts to reduce adverse childhood experiences. Without the 211 resource and referral helpline and the navigation services that our Health Council provides, we would face overwhelming difficulty connecting families to critical vital services. The Chaves County Health Council hosts the yearly Health Expo, last year connecting over 1,800 residents to preventative care and organizations that are dedicated to improving the lives of our families. And without our Health Council, we would lose a backbone organization that has been instrumental in implementing programs aimed at preventing suicide and youth homicide in our county. Only through adequate funding will these programs continue and expand to meet the increasing needs that our residents face.
Thank you. Thank you, Geraldine, for sharing that beautiful video of community voices. And to our dear friends who are here with us today, we're going to include a link to a sort of word cloud, as we would love to hear from each of you in terms of your reactions to these community voices that we're able to learn from today. I got to say, I am continuously humbled by the dedication of county and tribal health councils, and of course the key collaborations that they lead and participate in on improving health, conditions and quality of life across our state. So as you, and I'm gonna do the same, gonna go to the link, and Geraldine Antonio shares, she's in awe of all county and tribal health councils in their vital work. And so we see some reactions here as inspiration, dedication, heart. Wow, that's how I feel every day, my friends. I'm wowed by our county and tribal health councils. Pura vida. Thank you for that. We'll give folks a few more seconds if you feel inspired to share your reaction, what came up for you during, as you were listening to the voices from our various community members and partners. Collaboration, yes, thank you for that. Collaboration is at the heart of the work of health councils, cultivating partnerships, working together in service of communities across our state. Amazing, organic, yes, everything in our sphere here at with county and tribal health councils, with NMHC, we are not hindered by not having a budget. We're not hindered by perceived limitations. And of course, with these summits, we are deeply, deeply grateful to Encorum Health Foundation for making these summits a possibility. And it's these videos that you saw were a true collaboration with county and tribal health councils and community members, authentic. That's great feedback. Thank you. Dedication, commitment, New Mexico voices, appreciation, inclusiveness. Yes, representation, right? When we think of health equity, representation is so essential. Impact, heart, feedback, equity, health equity. And of course, all this hard work can only, and the impact, the meaningful impact that's rendered from health council's work can only be possible with funding, reoccurring, continuing optimal funding. So yeah, underfunded, right? That's something that's very clear to all of us here at NMHC and Health Council. So it looks like we have sort of a synergy alignment around collaboration and dedication. Diligence is another one that's coming up for folks. Love, amazing. Thank you so much. Thank you all for sharing with us from your hearts in reflection to our community voices that we were able to share today. And on that note, my dear friends, let's talk about alignment. When we look at the work of county and tribal health councils thus far, you are, I'm sure, appreciating how deeply aligned their work is to governor priorities. And this next slide here, curated again by our dear friend, Emily McRae at Public Health Institute, formerly known as Center for Health and Innovation. We're looking at 5 of the 10 governor priorities, right? So if we hover over behavioral health, and again, we're going to share this with all of you. We hover over behavioral health, as Geraldine Antonio noted, as Secretary Allen noted. You know, health is not a compartmentalized thing. Behavioral health intersects with so many other priorities. And here on the right-hand side, you'll see, you know, Firearm Industry Accountability Act, the raising the age to 21 for certain firearm purchases, all the different priorities that relate also to behavioral health. And then as we've hovered over behavioral health, you're going to see some data points here of the current metrics, meaning the impact that health councils are rendering every single day, actively rendering in service of communities. So, for example, health councils have delivered over 1,000 Narcan trainings. Narcan is a pharmaceutical that helps save the lives of people who are overdosing from opioids. They have distributed over 4,500 Narcan kits. That's significant. That's over 4,500 lives being saved, preventing overdose. Also over 260 timed pill boxes to make sure our elderly population or folks who are on medication are taking their medication in a timely manner. Also, the kids are not getting into pharmaceuticals, creating another risk. Also, over 1,100 community members trained in mental health first aid, and over 1,300 medication log boxes, again, preventing any kind of potential risk to children or others in accessing, you know, pharmaceuticals that can pose a health hazard. And also distributing over 200 fentanyl test kits, right? That's another, fentanyl and opioid. New Mexico's been facing a huge crisis on, with fentanyl and opioid. So if we move over to firearm safety, these are some of the alignment with governor priorities, and health councils have distributed over 250 emergency kits and distributed almost close, if not, we're probably at 5,000, if not more, gun locks to keep people and children safe from gun, you know, accidents from misuse of firearms. And then if we hover over vaccinations, of course, we have still distribution of COVID test kits, over 3,900, still hosting COVID-related events, education, information, prevention, 18 so far, and then vaccination events at 41. Community outreach is at the heart of the work of county and tribal health councils. So we have over community outreach. Over 80,000 community members reach thus far with various services from health councils in education, prevention, intervention effort, distribution of various, as noted before, Narcan kits, for example, COVID test kits, for example, over 290 community events, health events, over 13,000 education materials distributed. And I want to go back to the vaccination really quick. I just missed noting these specific data points obviously are aligned with governor priorities. in the Healthcare Authority Department as well, right? DOH, Healthcare Authority, and other state agencies. And then food accessibility, right? Making sure that folks have access to nourishing, healthy foods. Over 24,000 food boxes distributed. I know at the end of the year, I think we had distributed over 150,000. Working towards strategic water supplies. Currently, 112.7 tons of food have been distributed, and also have hosted 4 diabetes prevention related events. So to give an example, really high level, and just a few examples of how deeply aligned the work that health councils are driving at the local level is aligned with a statewide health goals, and particularly with the governor priorities, DOH, and others. And so if we move on to the next slide, in thinking about behavioral health, of course, being our top tier red alert, and how intersectional behavioral health is to other health indicators. This is a infographic that was also curated by our friends at Public Health Institute. And this data is from the Healthy People 2030 research by the U.S. Department of Health and Human Services. So for example, if we hover over drug and alcohol use disorder, we can see all of the other initiatives and efforts of addressing this specific priority in relation, right, to behavioral health. Everything's so intersectional. And this is another depiction of where health councils are, serving communities and improving conditions, health conditions in these particular areas in various ways, in various degrees within their communities. Services that are informed by communities, initiatives that are informed by communities through collaboration, that are culturally tailored as well. So we hover over to mental health. That's another intersection here. We have suicide prevention. Health councils are driving significant efforts in that area. Youth being screened and treated for depression, mental health services in schools. I know a number of our health councils. Lincoln, for example, works closely with their school districts in addressing mental health needs for our children and youth, and suicide prevention as well. People with disability to afford a preventive care. So, health councils, as you know, are the collaborators, but also the coordinators of services, connecting local community members with critical services that they need in real time, right? So together we get to work on solutions that are actionable, that we can drive in this very moment, in this year, and of course, together build towards the future. And so if we hover over violence prevention, right? That's another one that's very intersectional, addressing preventing youth from carrying firearms, again, suicide prevention, homicide prevention, firearm safety. As you noted before, health councils are a critical partner in distributing gun locks. And so we can spend a whole day just on these 2 slides, but just to give you an idea of how multidisciplinary the work of health councils are at the local and systems level, and with our key partners in terms of our state agencies, county commissions, care management organizations, and the list goes on. So let's move towards, again, we will be sharing these slides with you so you can have time to dive a little deeper into these. And I want to introduce our first presenters here, our dear friends from Cañoncito Band of Navajos, Dr. Carolyn Morris and Sarah Bitsu. Thank you so much for joining us today and bringing your voice, your expertise and wisdom to this summit. And Sam, if we can spotlight Dr. Carolyn Morris and Sarah Bitsu. Let's make sure if we have okay, so I think Dr. Morris will be joining us here momentarily. Is that correct? Sam, can you hear me?
Yes, I can. I'm checking for her right now.
Okay. And while we wait for Dr. Morris, I just want to take a quick moment and give a special thanks to some of our representatives and senators who have representation here today. Representative Parajon, Senator Ben Lujan, Senator Worth, and Representative, oh, I did say Lujan. So I just wanted to say thank you. And let's see if Dr. Morris is ready.
Hi, Val, this is Geraldine. Sarah or Dr. Morris, if you see a button to promote to a panelist, go ahead and accept that so you can go ahead and begin your presentation. If not, Val, should we give space for Tana and then we'll go ahead and come back to Sarah?
Absolutely.
Oh, sorry, Sarah's on, I think. Hi, Sarah.
Okay. So while we wait, we're gonna continue with our agenda here, and I want to welcome Tana Beverwick Abuda. She's our Health Council Coordinator at the Rio Arriba County Health Council. Welcome, Tana. Such an honor to have you here with us today.
Hi, everybody. So nice to hear about all the great work everybody is doing. And even though this is the second time I've been in this summit, I continue to be inspired. And it's just a great thing to have put these summits together. So I'm speaking from Espanola. And I'm the coordinator for our Rio Arriba Community Health Council. I'm just going to speak for a few minutes about what I see has made our health council successful. The first point I want to talk about is our journey from equity as a deliverable on the CDC Kellogg grant to equity as a developed concept that's embedded into everything that we do. So the power of the Health Council, like many people have spoken about already, is the on-the-ground perspective from the grassroots community. And you can't have health equity without having the voices of people who are experiencing the health issue at the ground level. And so the CDC Kellogg funding gave us the opportunity to create an equity team. And then that team matured so much that they worked themselves out of a job, basically. They figured, you know what, why are we having a meeting about health equity instead of just being embedded in everything that we do, making sure that there's an equitable lens to all of our projects. And so that's been a real success with our Health Council. We did make the choice to change our fiscal sponsorship of our Health Council away from our county Health and Human Services Department, which was a difficult but ultimately very good decision. We are now working well with our county. We have more responsibility around the money that comes in for health councils that is intended to affect health outcomes on the ground. And that's exactly what we're doing. So that's been part of our journey. And then really important, the last point I'll talk about is collaboration. So as you could see from the videos, there were 3 of us who spoke about our health council in those videos about what it would be like to not have a health council, the strength of our health council. Collaboration and partnership is so crucial. But there are a few points that the Alliance has helped us understand, that the Department of Health promotion teams has helped us understand. And that is, number one, that good community organizing and good public health, of course, necessitates knowing what already exists. When an organization is sitting anywhere except in the community where they're doing programming, it really is impossible for them to know everything that's going on the ground. So you have to use health councils and the people who are living in the community to really understand what's already going on, so that number one, you don't make people mad when you plop a program that was intended for the whole state into a community that doesn't need it, that is already doing something similar, that that programming is going to feel redundant. So health councils have a lot of power there to help the decision makers at the Department of Health, decision makers in Santa Fe, in the Roundhouse, really hear the voices of the people and know what's actually going on. Reinventing a wheel around public health and healthcare, there's just no time for that. There are plenty of new wheels to be made, and so wasting time reinventing programming that's already happening on the ground level is something health councils can help big decision makers avoid. And then I just want to speak to collaboration for funding sources. So a huge, huge thank you to the Alliance and to the Department of Health and to everybody, all of our representatives who have spoken, and senators who supported the new funding this year. That's incredibly helpful. And also to bring up the point that health councils collaborate with lots of different funding sources, because when you work in a community, there here in our community, there are SAMHSA grants that are happening around behavioral health and substance use prevention and treatment. And so when our health council is working within our behavioral health action team, we work a lot with the people who are funded by SAMHSA. We work with the public schools. Obviously, those are funded through the Department of Education. We work through lots of different collaborators, and it's just a beautiful thing. So if anybody has any questions about our health council here in Rio Arriba, I don't know if I can see the chat in a webinar. I'm just happy that my camera is working today. Yeah. But please, I'd be happy to answer any questions.
Thank you, Tana. Thank you for all the work you lead in your communities with all your key partners, giving voice and representation to Rio Arriba from our community members. So thank you. And just looking in the Q&A, not seeing any questions thus far, but of course, and Geraldine is sharing Rio Arriba's Health Council webpage for all of you to have access to and learn more about Rio Arriba. And we thank you, Tana. So grateful for you, your leadership, your dedication. Thank you. All right, team. We have Geraldine. I'm so sorry. I lost my cue. Can you tell me who's next?
Yes, Sarah Batui from Canyon Tito Band of Navajos. So Sarah, if you can unmute and if you'd like, turn on your video, you'll be up next.
Hi, Geraldine. Are you able to hear me?
We can hear you.
Okay. There was a blackout or something happened. I'm having a hard time with my camera right now, but you can hear me. I don't want to turn this whole thing off. Can I just go ahead and do without the camera?
Yes, go right ahead.
That's not coming on.
Absolutely.
Okay.
All right, and you're good to go, Sarah.
Okay, I'm hoping that Dr. Morse got back on as well. I'd like to share this with her. She can also point out on some stuff. Yes, we've been participating with the Health Council, and we're with the Canyoncito Band of Navajo Health Center, and our Health Council is at East Navigated Health council. So that's a Navajo word that says at health council. So that's what it is. Yes, we did a community assessment, needing to hear what the community wanted and need and what they thought about. And of course, in doing this assessment, we were able to get the key points and what the problems were, although we do know of a lot of problems in that area of substance abuse and other things. And the solution and how it played out for us was that we're able to do the community health improvement plan, which was really helpful because it gave us the guideline in recognizing those. And our key partners in helping do that assessment was the Albuquerque Area Southwest Tribal Epidemiology Center. And as we did partner with them, we were one of the recipient of the 988 Tribal Response Grant Program, and that's how we've been collaborating with them, along with other partners that we have besides that. So we're able to implement a lot of these activities. So the report identified, some of the community strength and some gaps and areas of improvement that needed to be. So in doing so, we're able to support the community with programs like behavioral health, and we're hub over a lot of programs. We're somewhat a patient-centered medical home. So we have community health representative, diabetes, dental, specialty care, women's health. We have a number of different departments that we partner with as well. So in doing so, most recently added to some of our service with the behavioral health has been the MAT program, the medical assisted treatment. So we've added that. We are teaming up with the medical staff and also getting some of our prevention people trained to be able to distribute Narcan, administer Narcan, and also we were able to also get like fentanyl test strip kits. So there's a number of things we've been doing. So, and that's the part I wanted Dr. Morris to also implement. I'm not sure if she's on the line. If not, okay. So in doing so, culturally, we all the services that we do, it's intertwined with the prevention activities that we do. It intertwines with the cultural activities, in anywhere from implementing to the youth, to the families. We do traditional dressmaking, weaving, gardening, parenting, talking circle. As you can see on the page, we have a setup of a teepee. We do talking circle there and drumming. So most recently, we've done spring youth camp. There, we're able to implement a lot of cultural activities as well, like drum making, singing. So we've done a lot of that. And then on the other side, we continue to do daily, weekly outreach prevention activity. As we speak right now, some of our prevention staff are out we have 2 small communities. There's a 90-unit housing, that's where they are right now. They're doing an Narcan demonstration and distributing Narcan. So that's what they're doing. And that's what the funding of 988 that we're able to get supplies and get training to do these things. And the behavioral health department at large is able to deal with prevention, intervention, treatment. And just most recently, from some of these fundings, we also were able to develop a booklet, which is now our toolkit, and we're calling it Keeping Our Relatives Safe. So what it is it's a booklet talking about understanding opioid, and it's culturally tailored, especially for Cañoncito Band of Navajo Health Center, not health center, but the community. So there's some really colorful drawings in there, and we presented this to the community and to our youth, and it was something else. It was really nice. They were able to relate to it because it was tailored for the community itself. And we do partner with UNM and other outside entities as well to promote health awareness, to promote a lot of these healthy life skills, to be able to have the families utilize this and revitalize in a healthy way to thrive on this. The pandemic, it sure did hit us hard here in the community. So, and we're relying on these recurring fundings like this one. So we're thankful for that. Yeah, I have this in a nutshell of this now.
Thank you so much, Ms.
Uh-huh.
Pitsu. We're so grateful to you and the Cañoncito Band of Navajos for all the ways in which you show up for communities and all the vital and critical work you are driving that is having a very meaningful, impact in the lives of folks in communities there. So thank you so much for your dedication and your leadership. And your time today, even with these connection situations that are happening in your area. So grateful that you took the extra effort and stick with us here even via phone. So we appreciate you. Geraldine Antonio is sharing the website to the Cañoncito Band of Navajos. So we'll love for you all to take a look and connect and learn more from Ms. Pitsu and Dr. Morris and others from our friends at the Cañoncito Band of Navajos. Thank you, thank you, thank you. And next, we want to just confirm, because I know there's been some connectivity issues in that area. Christopher Hudson, there you are, my friend.
Yeah, no, I was
Yes.
between my phone and my computer, so I had to set up
Thank you. I gotta say, of course, gotta introduce you. I have
stuff.
to introduce you, our vice chair, Christopher Hudson,
I
our
had to make
vice.
sure I had our shirt on.
Yes. Whoop, whoop.
Kind of rep the shirt a little bit today. The merch.
Yes.
Hello,
So
everyone. Yeah, thank you so much, Valerie. I really appreciate the time to talk about our Health Council and present a little bit, probably from our little fact sheet here that we made. I don't know if I can share my screen. Oh, yeah, I can. Okay, cool. I wasn't sure in this webinar area. But yeah, let me talk a little bit about our McKinley Community Health Alliance. Let's see here. Can you guys see that okay? Great. Awesome. Well, let me just introduce myself, actually. Hello, everyone. Yate, Christopher Hudson, and Sheh, Siskutni, Nishlin, Shidnachini, Bashichin, Kiani, Dishache, Tabaha, Dishanilla. I've been our coordinator, our health council coordinator for the last 6 or 7 years. I think it's almost 8 years now. It's going to getting up there. I'm like, oh my. And I've been a project manager for maybe the last few years, graduated from coordinating, and, with all the admin work and all the other jobs that we do for health councils, I felt like, a little bit of a bump was ensured, just to better convey to our partners what kind of work we do. And I feel like sometimes coordinator doesn't encompass everything that maybe a health council program person does for all of our stuff. So yeah, I've been really excited about this work since I started. I got involved because my aunt had asked me to take some notes at some meetings, and I was selling some cakes and candy apples at local laundromats and stuff, trying to figure out what I wanted to do because I had dropped out of college and was on a string of servers jobs for a while until I moved back home, and I was like, I don't want to do a server job. So cakes and candy apples was something pretty fun, and it actually was a lot more independent. So yeah, I was doing that, and then I was taking notes and things, and it just kind of came in to play that, the coordinator was leaving her position, and that there would no longer be anybody to work on getting the group together. And I had gained some knowledge as the note taker, and I felt like, well, if nobody else wants to do it, I can at least get people together. I can at least get us together to hold the meetings and, run through the meetings, because I had some previous knowledge with parliamentary procedure back in high school. So at least, I knew how to make motions and move things along. And it just really blossomed from there. And, the same thing happened with our health councils unfolding. We formed in 1998. 1998, as a non-hierarchical or a shared leadership structure. So instead of, one person at the top in a triangle and everyone telling everybody what to do, our health council works in more of a circular kind of function. We have our coordinator, we have our core team membership, and then we have the rest of our membership when we want to move things. But we share the leadership in moving forward our projects, in moving forward our health council, and a lot of those things. And we started off as working on managed Medicaid in 1998, along with the county. They had done updates to the Medicaid enrollment. They're always doing updates, so I guess this is part of the work. But they are doing updates, and the county and the Health Council and the McKinley County Child Health Council, Maternal Health Council, merged in 2004. And since then, our definition of health has really immensely grown, other than just, the regular things that we keep track of as far as like healthy living goes, food, nutrition, disease. A lot of what we feel like health is already there, but also our health council started working on deeper issues into how people get access to services, resources, and then also just understanding that there was something afoot, that there was other root causes. Us as public health people tend to call them social determinants of health, and they are, but we also began to unravel those issues and found like underlying root causes of poverty and income inequity, institutional racism, and multi-generational trauma. For those who don't know, McKinley County is about maybe 70 to 75 to 80% Native American, maybe 70 to 80. It depends on the weekend. But yeah, it's about 70 to 80% Native American, Navajo, some Zuni, some other folks too as well too. But yeah, we definitely have a very diverse population compared to a lot of the state, especially along the Rio Grande corridor. And I always, and our group has always felt that has had some advantages, of course, but also some disadvantages for our community's health. And a lot of what we've been working on as a team and as a council has been really pushing up against that notion of what health really means for people of color, especially Native Americans, who, you know, we don't get all of our services all the time from the state government or from our more local sources, but it comes from federal too. So we have not only a diverse community, but we have a diverse partnership than what most people are regularly working with. We have county, we have city, we have federal, we have tribal. It's a lot of partnerships and a lot of different systems to manage. So it's really been a shared workload for our council to be able to develop this way. And yeah, it's been going for the last 25 years. This was just a little bit about our mission, membership, vision. I think this is on our Health Council's website. So if you want to read a little more thoroughly on that one, that's okay. I was just giving you a little overview. Our Health Alliance website is mckinleyhealthalliance.org. That was also something we put together in the last 5 years, 6 years, was the website. And then also our Facebook socials. So not only do we get people coming in on the website and through the email, which is everly endless. As a coordinator, I'm always having emails. And then also on the socials, which has been really great because it helps to bring in more people from that community sense, from that boots on the ground, from that community organizer level. We really get a lot of community that comes through that way. So for this last maybe year, I just want to highlight on some of the projects that we've been working on too, and how that our definition of health has really worked to broaden these projects out and really work on community health together. The major one that we've been working on is our Native American Fund Zone Grant project, and that's our housing justice project. This grew out of an evolution of our previous housing health impact assessment team, who finished our HIA in 2022. That one we were awarded by CONALMA to do the work, and those that have done a health impact assessment might know that it's really geared towards gathering data about our community from the source of those being most impacted. So for our housing in Gallup Health Impact Assessment, we really focused on the unsheltered and the unhoused folks that were in between services and things like that, and those that were at risk of losing their housing. So at the time during the pandemic, we are hearing a lot about how people were beginning to lose their homes up until the eviction moratorium was placed on all of the state by the governor. Luckily, you know, we were able to work with our community and really figure out who was couch surfing or who was home. And we did that in a really different manner than we have ever done before because of the COVID. We did it in drive up form. So I really want to thank my team and all of the interns that we had for that too, just to get that done. It was really, really, really amazing, but also really very challenging. So yeah, we moved from that health impact assessment and we're able to garner some support from the collaborative grant that was put together between the McCune Foundation, New Mexico Foundation, CONALMA. There was a lot more other funders into this, but it was one of the first times that funders actually got together to put a pool of money together. In previous years, our health council, along with the Alliance of Health Councils and other partners in through Mexico, were telling funders we need a bigger pool of money that is unrestricted, and this was a result of that. So we thank our funders too. But now the project is very much underway. We got our planning grant. We were able to spend some money and give it to our partners who are upholding a housing first model in their own partner or in their own projects. And we really geared some of our money towards that because we feel like that was one of our recommendations from our health impact assessment, is that we should have a housing first policy for our unhoused and unsheltered folks, because we feel that, you know, you can't get sober if you're worrying about where you're living. I myself have been sober for the last 8 or 9 years too as well, and understand very much how much goes into that kind of work, spiritually and just physically. You know, it's a toll on everyone. So we really want our project to get off on uplifting those voices. So right now we have hired a community organizer for housing only, because we felt that we needed that. It couldn't just be Chris anymore doing that, because I was busy doing all the other stuff for our health council. So we used half of that funding, 50,000, to be able to hire an organizer for the year and give her training. And we didn't really have a lot of requirements, because I also started at a place where, you know, it was like, well, this is what you're going to learn. This is how you're going to learn. It was very independent. So we're going in that same manner with our community organizer, and she's just blossoming. It's taking a little more time. And there's been some challenges. We did hire another individual, but that didn't work out as well. I think the nature of how we do our work together in that shared leadership is hard for some folks to get used to. Some people do work better when they're just told what to do. And you know, just we're learning those things is all I really want to say, is that sometimes we get into these things or think it's going to be all perfect, but sometimes, you know, things happen. And luckily our funders, our partners, our team have all been very patient with us in understanding that these things happen. And I really like how our evolution and then how our team growth has grown since then. So I'm really proud of that project and where it's come from just that little piece of an idea of like, hey, we really need to work on housing. And this was back in 2018 or so when we started to see these issues before the pandemic. The other ones that we've been working on are the McKean Foundation multi-year grant. Oh, this is a new one. So we applied for this last year and we weren't too sure about how we were going to go about it. But because of the Native American Fund Zone grant, the McKean Foundation saw that we were doing a lot of work and they really understood how our health council was really going about it. And in the past, they were a little confused about that. But this year they were like, hey, we've seen the work you've done. We want you to apply for this multi-year grant. It's the first year we've done it in a while. And we want to make it unrestricted because we heard that on the other grants that's so helpful. So we were able to apply and we were actually able to get it. So we have 3 years of unrestricted funding of at least $35,000. So that will go a long way for other little organizers, other Christophers, other Anne Arundels, other people from our community to really uplift them. Because I feel like boots on the ground is really great, but we also need those community organizers to get that work done. At the end of the day, us coordinators, us program managers do get a lot done, but if we don't have those people to help us do those additional community work, you know, it falters. It really does. Definitely. It's more of a together work. Other ones that we're celebrating this year, this is our 25th year. 25 years is a long time. I really wanted to celebrate that. We often don't get a lot of time to celebrate in our teams. We just go, we're so used to adjusting to each public health emergency that sometimes we forget that. So this last December, we actually had a big dinner. We invited all of our old founders, and partners, and we just had a really good time. We really wanted to thank everyone for that. And the Alliance of Health Councils, we want to thank everybody here and all of our health councils that have been working for everything this last year. I'll give a little end of the summit speech, but I think I'm a little over time. Was there anything that anybody had any questions about in particular about our health council? I covered maybe just the big bits, but maybe there were some more things that you guys had in questions.
Hi, Chris. Val here. Yes, I'm looking through to see. No, that was a great overview of the work you're driving and the successes that you get to celebrate with the team. I'm looking into our Q&A, none at this time, but of course, if you could share with us your handout too, because it looks like a lot's been up, newly added. We would love to share that with our attendees here as well.
Yeah, I see a question too on taking a look at our health impact assessment. So that's also on our website under the community health data page, but I'm going to go ahead and copy and paste the link here for you, Kara.
Yes, and Shelly has raised her hand.
Yeah, go ahead, Shelley.
Sam, if you can help me make sure we can unmute Shelly if the webinar is not allowing her to for some reason.
I should also know on the health impact assessment, we only did within the Gallup City area, as we felt like, we could not get a lot of Navajo Nation data. And we're still kind of dealing with that too on another end too. And then also on the county side. So we kind of focused a little more within Gallup in the the urban area for our city.
Good to know, Christopher. Thank you. Shelly, go ahead. It sounds like you have a question. Shelly Begay, Healthcare Associate. Maybe there's an audio issue. Shelly, can you come on?
We can't hear you, Shelly, if you are speaking. There you are.
I think you just need to unmute, Shelly. We can see you now, but we just can't hear you.
Oh, we still can't hear you, my friend. Thank you. Shelly's going to type it, and we will follow up momentarily. Okay, it sounds like, okay, so she'll take her time.
Give her a second. Another highlight, we've been able to, with all of this funding and all of this work, is be able to hire 3 interns actually for that health impact assessment. And then 2 of them actually went on to become a part of our work already. So one of them is a core team member now, and the other one is working on stuff with our partners. So I always tell my team this is that, the work and, the health problems will persist, that will always be there. But I feel like the relationships are what really matter. So I spend a lot of my time just kind of working through relationship stuff and just knowing things about people to be able to get an engaged amount of work and participation from folks, because when we make work fun, more people are engaged in it, and it's not really work anymore. I think one of the things I like best about my work is that I love it. And like one of the things about running for office this last year was that made me worry was like, I hope it doesn't make me hate my work. But yeah, luckily it hasn't, and I'm really excited.
No,
Shelly, did you want to type it? Was she able to type it?
No, Christopher, not yet. So we're going to give her some time, and we'll just to be mindful of people's time. Oh, here we go. Thank you, Christopher.
Oh, okay.
Go ahead.
Thank you, Christopher, for all the information. I have a question. As you mentioned, you service many Native Americans in the area of resources. We have families that are here in Alamo, New Mexico, that are facing a number of housing issues, but are not able to tap into resources for housing. Are you funding resources only for McKinley residents? As of now, right now, yeah, and mainly Native American folks, but I think that also would transition into more of a statewide thing if we really would like to. But I think with our high priority of community members is really focused on those that are unsheltered and those that are at risk of being evicted. And unfortunately, when we work with those populations of people, we can't really have them come and testify at like events and things or spare their time because they're so busy surviving. So a lot of our work this year was geared towards not only getting that community organizer ready, but also holding a community housing justice fair to be able to give resources to these community folks. And the one thing that we found with a lot of the housing fairs that were going on, not only across the state, was that they were providing resources, but they were not resources that people could use immediately. They were resources like you have to fill out this application, then you have to go here and there, and then you have to do this. But it wasn't direct resources of like, well, here's $400 to pay your rent so that we don't get evicted this week. I didn't see anybody really actively doing that. So yeah, we've been able to help in that manner through our partnerships and through those people that do have a housing first policy already. We've been able to infuse money towards small grants out of our funds, and they've been able to help Native American families get stay in housing or keep their housing. So it's a small scale thing. $200,000 does not go far, especially in housing when people, when they're behind, it might be $1,000. We recently heard about a family that's $4,000 behind, and we want to help them, but also at the same time we're trying to leeway how much time she has, because she's in her house with her kids right now, and they're in school, or they were in school, and there's a fluctuation. So it's a lot of like back and forth. We're not asking these families to fill out applications and do all these other things or jump through all these hoops to get through the funding, but we also want to know where they're coming from and want to make sure that we're doing the best we can for them too as well. So yeah, we would love to do a whole statewide thing, but I feel like that's more partnerships and then more funding. But yeah, we also advocate on the statewide level along with our partners theirs too, especially with the New Mexico Coalition to End Homelessness. So we have a lot of partnerships that work back in there. In Albuquerque, we also work with the Native American Indigenous Housing Justice Group. So, we start off small. When we first did this housing stuff, it was just on the HIA in Gallup, and now it's grown into so much more that we've had these partnerships. So I hope it continues to grow and that we're actually able to help families across the state, because one of the biggest disparities and one of the measurements that we want to work at, because a lot of people have been asking me, what's your measurements? How are you going to show that you've been working on the housing thing? And one of the things that we have is that, in 2020 or so, there was the Coalition to End Homelessness's data point around Native Americans who are homeless, and that was around 13.9%. 13 point something percent. It was really high compared to the 8.8%, 8.1% of the state that we inhabit. So we are disproportionately homeless compared to other races and demographics. So I think that's where we really want to work at in trying to, across the state, is trying to get those Native American families back housed or, keep them housed. And I think that's primarily where we can start to work with. And then all the other stuff with housing, I think one of the things to understand, and this is the thing that we're working with the team, is that it's multi-layered and it has different sectors. So we have the unsheltered population and those who are trying to get through, and those ones that are trying to stave off eviction, and then we have the people that are working and have housing, but it's not affordable. They're renting, they're spending all their money towards what could be a mortgage, but they can't get into a house because it's too expensive. And we all have heard how the housing crisis has been growing because of the supplies, because of the contractors, because of the policies, so many different reasons why that is going wrong. So we have that, and then we have like a third option where people make enough money where they're buying houses, but they're destabilizing other housing because they're trying to make investments out of those housings, and that further destabilizes things on that end. And then finally, we have a third or fourth one, which is kind of in there in all of them, and this is corporate housing. So we have a lot of entities and investment firms starting to buy up trailer parks, apartments, housings, little housings to be able to flip them, but also make money off of all of that, because when there's money to be made, people are going to be there. And unfortunately, a lot of the hold at a state level is from the realtors. One thing that we need to understand that our legislator people do, or leadership is that there's a lot of realtors and lobbyists working against housing in this way. They want to make that money, and they're putting it upon our people, and it's just making things harder. So it's a complicated issue, definitely. and we're taking our time to go through it, but we're definitely making sure we're taking our time with the most affected population, because we're health councils, because we're community organizers. We work from the bottom up, we work from the grassroots, and we go from there. Ever since I started, ever since I've done this work, it's always been grassroots rooted, and I always want to keep that going for all of our health councils as well as our teams. Okay.
Thank
Thanks,
you,
everyone.
Christopher. So appreciate you. Thank you for all the critical work you and your team are leading in service of communities in McKinley County. So grateful. And for your time today. Thank you, my friend. Love your hat collection, by the way. So on to our next presenter. Please join me in welcoming Kayla Blanchard from Otero County Community Health Council, who is making strides with her health council on addressing substance misuse and improving population health through their healthy eating and active living program. And I think, Geraldine, you've got this, right?
Yes.
Thank
Again,
you.
just a thumbs up if audio is coming through.
Good afternoon, everyone. Thank you so much for this opportunity to share a little bit about my health council. I'm Kayla Blanchard, the Health Equity Specialist and Coordinator for the Otero County Community Health Council. To start this off, I'm going to take you on a journey. The Otero County Community Health Council has been active since 1996. We envision our county to be a place where all people have a fair and just opportunity to be as healthy as possible. In order to achieve our vision, we promote programs, practices, and policies that advance health equity. Of course, health equity is going to look different depending on the populations or communities we interact with, so we have devised 3 different action teams to accomplish our Health Council's priorities. We prioritize reducing substance-related harm, improving outcomes for justice-involved families, civic engagement, and of course, health equity in the varying settings we are fortunate enough to occupy. Before I get into the work we do, I want to share more about our Health Council membership. Our membership consists of diverse individuals ranging from behavioral health professionals, public health professionals, healthcare providers, community-based agencies and nonprofits, to local government officials, military personnel, MCOs, and interested community members. We strive to foster a sense of belonging and unity among our members and county residents. We actively engage with community members, ensuring their voices are heard and their needs are met. Through community outreach events, as well as formal and informal conversations, we strengthen social ties and promote collective well-being. I would be amiss to not mention the leadership of my Health Council. Our Executive Health Council Committee consists of strong, forward-thinking, driven women who are dedicated to incorporating the voices of everyone, specifically the ones that go unheard and overlooked, to achieve optimal community health. We have 3 elected officers, as well as representation from DOH, Otero County Healthcare Services Department, and our fiscal agent, as well as 3 contractors. Each individual brings a unique experience and perspective to the table that is essential in guiding our work towards optimal delivery of equity within our capacity. Additionally, our Health Council believes in giving people first and second chances by providing the tools, opportunities, and support to thrive, thus leading to strengthening relationships and enhancing the work we do by incorporating those diverse and necessary voices into our work. With that being said, our Health Council demonstrates a strong commitment to improving the lives of our county residents. We assess, promote, and enhance the health and well-being of county residents by encouraging and supporting broad-based community involvement with the help of our partner entity, the Behavioral Health Collaborative, and our 3 action teams. So our first team is the Healthy Eating Active Living that focuses on nutritional education, access to healthy foods, and increased physical activity. Our next team is Community Awareness, Resiliency, and Engagement, and it is committed to improving the outcomes for children, youth, and families with behavioral health challenges through education, engagement, and outreach. And lastly, our final action team is the Health Equity Action Team that addresses and works towards eliminating health disparities through community organizing and promoting civic engagement and civic health. In addition to the action teams and the General Health Council membership, we partner with numerous agencies and organizations, including but not limited to 100% Otero, Otero County, Christus Southern New Mexico, local school districts, the Mobile Crisis Response Team, Otero Public Health Office, state agencies, behavioral health providers and agencies, and so many community-based organizations. Through mass collaboration, we've conducted or supported several projects, initiatives, and assessments. To name a few, we have created food and community meal resource lists, a community scavenger trail hunt to promote physical activity, a Women of Color sexual empowerment series to provide culturally relevant and medically accurate sexual health information, Kindness Week promotion, crisis intervention training, the 2019 County Health Assessment, and so much more. Leveraging on what work is already being done within the Health Council, but also in the community, was the driving point for our development of our Community Health Improvement Plan, or our CHIP. After gathering community input and undergoing data and health priorities prioritization, we settled on focusing on mental health, which includes substance use, crisis response, access to care, and suicide prevention. However, with a focus on drivers of health and access issues of housing/homelessness and transportation. We are prioritizing individuals and families that are dealing with mental health and/or substance-related crises, people who are unhoused, experience housing insecurity, are in a gap, who need support but don't qualify, those who are reintegrating after incarceration, and people with a lack of dedicated transportation or with barriers to access basic needs. In addition to utilizing national data sources for local data, we also use local assessments like the 2019 County Health Assessment and the 100% Otero survey to inform our health priority selection process. To inform our goal development, we relied on our potential to address racial and other health inequities, our potential for interventions at multiple levels, so individual, organizational, community, and political/policy levels, as well as the extent to which it aligns with existing priorities/community buy-in and investment. So again, leveraging on what already exists to further the work and uplift it. We developed 4 short-term goals and 2 long-term goals to address our health priority. So far, we have played a key role in 5 initiatives that have focused on improving our community continuum of care to support people living with mental illness and/or substance use disorders. Those initiatives were the Crisis Intervention Training, the PIT Count, 100% Otero Summit, a Community Housing Symposium, and our County Sequential Intercept Mapping Workshop. So through our role with each initiative, we've assisted to improve communication and collaboration among government agencies, nonprofit organizations, and service providers. We also help to increase availability of resource listings to the community, to strengthen community relationships, increase visibility of services and supports for community members, and enhance communication of those agencies I just mentioned. We participated in 8 community outreach events that focused on raising awareness of and increasing access to existing resources since last summer. We also promote those events and resources regularly at monthly meetings, through email correspondence, and on our social media platforms. We've identified a team to develop an issue brief highlighting local housing and transportation needs and potential policy solutions so we can increase awareness of local needs and increase advocacy for housing and transportation policy improvements. So that is one way we intend to address housing and transportation needs on a policy level. Now, pivoting back to us crafting this action plan to align with existing priorities, our last short-term goal is to provide nonpartisan civic health training to at least 10 organizations. And I'll talk about our Health Council's commitment to civic health in just a bit, but our intention with this is to increase voter registration and voter participation, as well as increase the number of organizations participating in the National Nonpartisan Initiative ODR. So to promote civic engagement and civic health, we have conducted trainings at our meetings and other organizations' meetings, including 100% Otero. We've presented at the New Mexico Public Health Association, the New Mexico Primary Care Training Consortium, and we've administered a civic health survey to our membership to gather data that will inform our strategies. Additionally, our work has been recognized by the League of Women Voters Southern New Mexico as they presented me with the Making Democracy Work Award, which is truly a testament to our collective work as a health council to ensure that everyone has a fair and just opportunity to exercise their fundamental right to vote. We crafted our long-term goals to build upon the work that we are doing with the short-term goals. So we intend to conduct a housing and transportation equity assessment and share it with community leaders, partners, and decision makers, as well as increase past year civic participation among health council members. So the Otero County Community Health Council does a tremendous amount of work, and we take a multifaceted approach to ensuring equity for all communities. Not only are we composed of committed, driven individuals and agencies, but we are also forging a path to integrate both civic health into health equity conversations. A few of us participated in a 7-month civic health fellowship with VOTER, the national nonpartisan initiative that aims to integrate voter registration into the healthcare space. However, as public health professionals, we've adapted those strategies and tools to apply it to both clinical and community settings. Similar to the Health Council vision, we envision our county to be a place where everyone has a fair and just opportunity to participate in the democratic process. With the American Medical Association formally acknowledging voting as a social determinant of health last year, that just reinforces the importance of civic health promotion. 20% of our healthcare experiences are influenced by the policies our elected officials implement. So our Health Council promotes voter engagement in any way we can. We conduct trainings on the tools and our approach to various agencies like the Otero Public Health Office, the Counseling Center, which is a community mental health facility, the Family Medicine Residency Program, graduate students, community health workers, and at community events. Juneteenth celebration and Mescalero Health Fair are just 2 examples. We also presented at the New Mexico Public Health Association through their various events and at the state capitol last year. We recognize that your vote is your voice, and your voice is powerful and important in shaping the health of your community because you know your community best. So this was only a snippet of the work the Otero County Community Health Council does, but if you would like to know more, please feel free to contact me, join our membership, and attend our meetings. Hope to see you there. Thank you.
Got to unmute myself. Thank you to Kayla and her team for the great work that they're leading in their community. And now I'd like to invite you to welcome yes, I love the, was that the confetti or was that the cursor? I saw a confetti. Anyways, the next segment of our agenda today is a pathway forward. This is going to be an interactive segment of our programming that together, right, we get to make strides. Our collective wisdom, expertise, dedication. And so we want to capture some ideas, recommendations, potential collaborations in this collective vision for a healthy and thriving New Mexico. And so I want to first welcome Sephora Nepesh, who is the Executive Director of New Mexico Thrives and a very strong advocate of health councils. Sephora founded New Mexico Thrives to uplift the vital role of nonprofits in New Mexico's communities. Welcome, Sephora, and thank you for being with us today.
Thank you for having me, and I'm so excited to facilitate this next part of your summit. Valeria, will you outline the process, or would you like me to?
You go ahead, my friend. I think you got this down.
Okay. So, first of all, there is a link in the chat, and please click on that so that you have access to the Jamboard. And if you notice on the left side of the screen, in the toolbar, there are sticky notes. And you can hover over the sticky note, click on that, and write your ideas for what does a healthy community look like and feel like. And yes, thank you for demonstrating that. And please go ahead and jump in. Use whatever colors you like for the sticky note, and please put your ideas down for what a healthy community looks like and feels like. And we will give you a few moments to work on that, or a few minutes.
Yeah, and Sephora, I would just add again To our friends who are with us today, know that after the summit, we will be following up with an email to the recording, access to the recording of the summit, the slide deck, and of course, the Jamboard and other handouts that we've shared throughout today's programming. So rest assured you'll have access to this post the summit as well.
Yes, your ideas aren't going out into the ether. They will all be captured and shared back. So, thank you. Equal access to resources. Absolutely. Don't be shy. Put those ideas down on the sticky notes. What does a healthy community look like and feel like? Inclusivity. Parity in distribution of resources and funding. Yes. Working together to support others feels like togetherness. Access to resources based on community needs, culturally tailored. Absolutely. New Mexico is a multicultural state, and that is one of its beauties and strengths. Everyone in community can access everything they need. Pharmacy, thank you, food, outdoor space, job, school, etc., within a reasonable and safe distance from their home. And they have a safe and stable home. Fantastic. So somebody has clicked on the pen. Again, if you go into that toolbar on the left, at the very top, you will see a pen. So if there is an idea that has popped up that you really like, you can draw a heart, you can circle it, you can put a star there. Something to indicate that you think that's a fantastic idea. Oh, here come more. When a community feels connected and safe, equal access to resources, access to healthy food, affordable housing, quality healthcare, quality education, equitable paying jobs, quality of life, green nature, safe spaces for all, and transportation. And terrific, somebody has starred, they have a safe and stable home. Growing gardens, yes, neighbors giving each other rides, kids playing and laughing, absolutely. That reminds me of old-fashioned neighborhoods where everybody looked out for each other. Okay, job security, access to transportation, healthcare, available housing, safe communities, community participation, and food security, absolutely. So I'm going to take a moment as you're populating more ideas to remind us that equity and equitable are not the same. If things are equal, we all get the same amount. If things are equitable, people get the amount that they need, and that can vary based on circumstances and situations. Public transportation, alternative transit to cars, which are a leading cause of death in our state, and make infrastructure impossible to build off of, to build an equitable community. Not sure I understand all of that. Equitable, tailored to the specific needs of the individual, absolutely. Access to healthy, nutritious, quality foods, affordability, please, yes. We grow a lot of things in New Mexico, but mostly it's things like alfalfa for cattle, and we ship it out of state. Equitable, tailored to the needs, yes. Holistic approach to health, including humans, earth, animals, planets, and water. We are all interconnected. Not just people, but the environment and the animals. So take a moment, if you haven't already, and add stars or hearts or circles or some sort of mark to indicate the ideas you think really stand out. Strong interpersonal connections between neighbors. Yes, and that starts with individuals. Do you know your neighbors? Have you knocked on their door to say hello and see how they are? And if you have a garden, have you shared your garden produce? Working together to support others feels like togetherness. Okay. So take another minute or so to add your marks or add additional thoughts, and then we will move on to the next phase. Okay. Love the little hearts and stars. Okay, are we ready to move on? Please go to the next Jamboard. So what change is needed to create healthy and thriving communities? We want to be connected. We want to have equitable access to resources. We want access to safe housing, to green space, to food. We want to be more connected with our neighbors. What will it take to get us there? What are some steps or ideas for that? And can you expand that a little bit, please? Geraldine or Sam? Sam, I think. Community voices must be centered and inform the very services, policies, legislation in service of New Mexico. Absolutely. And that means we need to get community members to interim committees and to the legislature. And what will it take to do that? So yes, we need to center community voices and we need to show up. So how do we help community members to show up? And what other change is needed to create healthy, thriving communities? We have one idea. Surely you have more. Don't be shy. Great. And again, can you enlarge that, please? Resource the systems that already exist to serve communities like health councils, the Early Childhood Education Coalition, school-based clinics, behavioral health collaborations, etc. Absolutely. We have lots of tools, resources, organizations, coalitions working already in many of these areas, and you're right. Generally, they are underfunded, and we need to let our legislators know that funding those is a good first step. So legislators and community, we need, okay. No need to recreate the wheel. Absolutely. We have the people, systems, and dedication in place to meet the needs of our communities with intimate knowledge of what the needs are. Absolutely. And health councils play a critical role in that. We need leaders and decision makers to attend meetings. Well, they attend their own meetings. They don't necessarily attend health council meetings. So legislators and community members working together to problem solve. Yes, and that takes time. And I will say that we have an all-volunteer legislature. So our legislators do not get paid for their service. And unless they're retired or independently wealthy, many of them have jobs to support themselves and their families. So time is precious to many of them. Or scarce, a scarce resource. Policy change. We need to change policy around housing, which is directly informed by racism. Minimum lot size, single family, etc., and transportation, minimum parking setbacks, etc. That's a great one. And I suggest that perhaps we need to evaluate all of our bills, potential bills or potential new laws, to see if there is any racism built into them, or if they address racism to make things more equitable. Require legislation to be informed by health and environmental impact. That's great. And like we have a fiscal impact report, we could have a health and environmental report. But guess what? It'll take a bill to make that happen. And so we need to come together if that's something you want to do, and find a legislative champion and see if you can't get a bill like that passed. That would be phenomenal. All right. Let's take a moment and start starring and making marks to indicate which of these ideas you think are really stellar. We need to bring power to people who are just struggling so much to even just live and who cannot show up to have their voices heard. Health councils can bring those testimonials forward. Yes, and we should be asking funders to supply stipends to community members to be able to participate in the legislative and policy process. Require legislation to be, okay, I think I read that one already. And there are some comments in the chat. Require legislation in government entities to have trauma-informed and ACEs training. I think that would be phenomenal. And again, that's going to take some work to make sure that that message gets heard by the governor and by the legislators. And of course, something like that takes funding. Okay. Any last comments or thoughts? Please share your hearts and stars. We're going to wrap this up in another minute. And then pass it back so that we can wrap up the summit. Loving the hearts showing up. Any other comments? Final thoughts?
Yeah. Yes, Sephora, we just had a comment from Representative Allison. I think he is he still here with us? Allison? Yes, Representative Allison made a comment about the new healthcare authority investing in, for example, obviously county and tribal health councils, the work that NMHC leads. The resources are there. We did have a meeting with Secretary Carrie Armijo, and we're looking forward to circling back with her. I know we have a meeting coming up with Kira Ochoa as well from the Healthcare Authority. Representative Allison, thank you so much for being with us. And Debbie Ortiz expresses her gratitude again for advocating for county and tribal health councils. We all appreciate you. Thank you, thank you, thank you.
Indeed. And Valeria, I think it's time to pass it back to you.
Thank you so much for your facilitation again, my dear friends. We're going to be, sharing all of these resources with you. And let's see. Something to thank you, Anna, who's helping us with the slides. Is something that we at NMHC, what we believe is that, working together across sectors and investing in local communities will be key in co-creating, right, the healthiest state in the country, and moreover, setting a new standard for the entire nation. We're 2.11 million in population statewide. We have state reserves in the billions. We have the dedication, we have the expertise, the lived experience, the wisdom, the resources to ensure that every New Mexican has access to all the resources that they need to live a happy, healthy, and thriving life. And I want to, again, this is, I know it's a little bit content heavy. I will just touch on a couple of elements here. In terms of, as you've probably been hearing through the presentation, through our time together, we're asking for establishing, we're seeking to enlist the government to establish recurring optimal funding for health councils. Now, one thing that is true about county and tribal health councils, you know, their organizational structure differs, right? Some are sponsored by fiscal agents, other are county-based, other are tribal-based. And if you can think of New Mexico in those areas that are a bit more resourced, like in the metro area, Santa Fe, Las Cruces, right? In turn, some of those health councils may have access to more funding, you know, additional other types of funding opportunities than most. However, NMHC is taking a stand to make sure that all health councils are leveraged for success in service of our communities across the state. And so when we're looking at what is possible with establishing reoccurring optimal funding for health councils, these are the elements that can be made, that can be resourced in order to excel, right? Health councils have, through their own resilience, their dedication, continue to be here today, 30 years later, being deeply defunded, underfunded since 2010, right? That is a testament to their love and dedication to communities. But we get to be equitable when it comes to how we are leveraging health councils for success to really excel, to really liberate them so they can really grow in their collaborations, expand their coordinations, and grow their capacity so they have the opportunity to really serve communities at a scale that perhaps right now for a lot of them they're not able to, but they are because they're so deeply dedicated. So capacity, imagine health councils are at 2 or 3 full-time staff with equitable pay, with benefits, being able to really expand all of their education programming, their community engagement, building their membership. So that increases the diverse representation of communities across the state when through various collaborations or representing legislation for various policies that affect our community members, and also continuing to enhance our data-driven planning. So we're really delivering on implementations and these strategies that are based on concrete data that we have, understanding what our communities are facing, both from a quantitative to a qualitative standpoint. Also, robust implementation and action teams, right? So liberating health councils to be able to serve communities beyond a 2 or 3 sort of priority per the CHIPS that you learned earlier through Geraldine's presentation. And yes, those 3 indicators that care and preventing deaths, preventable deaths. There's so many other needs that our communities face every single day. We learned that from the presentations from health councils. We've learned it just now through this activity that Sephora facilitated. So there's a lot here that can really be leveraged to a scale that we haven't seen for a very, very, very long time because of the lack of investment. So this is where, yes, I'm being a bit bold here and essentially calling for support in enlisting all of you to join our advocacy efforts in engaging the state government to invest in county and tribal health councils. And with that, I want to move forward to our vice chair at NMHC, Christopher Hudson, to share his perspective too, from a health council perspective, how important it is to invest in county and tribal health councils. And Anna, if you could help me spotlighting our friend Christopher Hudson. And
Hey, can you guys hear me fine?
yes, we can now. Thank you,
Okay.
Christopher.
Yeah, so thank you everyone for joining us today. I really appreciate the 4 hours that you all spent with us. No, 3 hours, 3 hours. It felt like 4, but I think it was just because there was a lot of information and everything. So thank you everyone for joining us. Thank you for spending your afternoon with us. For those of you that made it to the other summit on Thursday, thank you again too for doing double duty. We want to send a huge thank you to Representative Allison for sponsoring our bill, as well as really working hard with Valeria and Geraldine in getting that $3 million. Really, it was a whole like team effort, and I really appreciate the Alliance of Health Councils for really working and conveying that along with Representative Allison. And we want to thank the Appropriation and Finance Committee from the House side, Representative Nathan Small. We really want to, uplift him. We really want to, because in years past, appropriations and finance is where we went to be tabled. In years past, we would always get up to that point and we would get tabled in appropriations and finance until this past new year when we had a new finance chair and a new membership of appropriations and finance, a little bit of a shakeup. So we really want to say thank you to the Appropriations and Finance Committee because we were giving them information for so long, and they really held up their end for the for all of the health councils, along with Representative Allison, and then also our other sponsors in years past, not only just around funding, but also in enshrining enacting the law that creates health councils, and that was Liz Thompson and Gail Armstrong. And we want to thank our previous executive directors. I forget their names right now. Sorry.
Sharon Finarelli.
Sharon Finarelli,
And-
thank you. All my names
and-
are all bundled up right now because I'm trying to remember all the people that I've met over the last 7 or 8 years that have really helped to move all these things forward. And Terry Rodriguez, definitely my first time at Public Health Day. She's like, you sound like you know what you're doing. We really need to highlight what health councils are doing. Can you talk? And I was just barely new and, getting back to used to talking to everyone all at one point in time. So I just want to send a huge thank you to all of those people that really worked on this huge monumental feat to get us this funding in the last year, as well as reenacting the laws that create our health councils in the first place. We also want to thank who was it? Oh yeah, the Department of Health for sticking in there, and all of our health promotions folks. I know right now a lot of us are dealing with the new funding, and there's some frustration there, and there's a lot of back and forth. But I really, throughout this whole process, I can't commend the staff enough from the Department of Health. Our health promotion staff, our people that are sticking in there across the state. We're seeing so many staffing levels and capacity not be where it's at, and we really appreciate what we do have left, and anything that we can do as health councils, we would like to help, because we can't move forward our state unless we can really help build those pieces up. And if health councils have an impact in anything, we can help alleviate that for our legislator too, as well as somebody had mentioned that voting is definitely a health impact, a health social determinant of health. But I would also commend our challenge health councils not only just to work on voting, but to work on getting people to run for office. We're the only, I hear this all the time, we're the only state with a volunteer legislator, and yet none of the volunteer legislator does anything about that, because they would rather have voices that aren't from maybe the certain areas. So, maybe we need to start working at that level and getting more people and community members that look like us, that have to struggle as much as we do in those offices. So definitely we have a lot of work ahead of us, not only just at a processing level, but also at a political level. And I feel like health councils have a say in a lot of that because we're able to advocate from our communities, because we're able to work on the grassroots level. Our voices matter and our communities matter. And we really need our legislators to hear that and understand that when we talk about, you know, what our communities need, it's not coming from high levels of data and information. I mean, sure, that's there, but it's really coming from the heart and soul of our communities, from the people that live on the streets, from the people that live in the housing, so the people that have to deal with disease and health complications, as well as the good things. Sometimes we forget to highlight all of the successes that we have in the community, the diversity, the ability to help one another when things are down, or, you know, to be able to respond in a mutual aid when we went through COVID. And now that we're going through the fires in the Southern, we're just seeing how our community can really come together past our differences and really help one another. So I really hope to exude that more with our communities. And I challenge all of our health councils to invite your legislators, to invite your decision makers, not just on the state side, but on the county and the city and the municipality level, to really just not only invite them to your meetings, which can be hard, you know, they have busy times as well too, but maybe also reaching out to them or meeting them where they're at in their community levels. Find out where your legislators or your decision makers are spending their time in the community and meet them there. If it's at, you know, Elks Club or at any of those other little things, you know, go meet them there. If it's at church, go meet them there. I'm not a religious person, but definitely I have respect for it. And definitely, you know, it's just a matter of meeting people where they're at. So we really want to, yeah, we really want to thank you all, challenge you all for the coming year, and really just kind of remind you all that we all have this love for you. We all have this continued community that we're building together, and, you know, together we'll get there. You know, our whole spiel is, you know, together for healthcare, and we really appreciate all that. I also want to say thank you to our president, Debbie Ortiz. She has been able to keep us all very aligned. Me and her were co-presidents for a while till things got a little too hairy. And I really just want to say and uplift all the work that she's done this last year for the team, as along with Valeria too. They've really held everything together to make sure our health councils were heard this past year.
Thank you, Chris. Thank you for your ongoing dedication and your leadership as well. We're in this together. We're stronger together. And on that note, as you can see, NMHC, County and Tribal Health Councils, we are advocacy in action along with our dedicated legislative supporters, champions, and key partners who also champion alongside us, and community members. And so we want to share some resources with you. Of course, thanking our main partner who made these summits possible, and Quorum Health Foundation. We wouldn't be able to do this without you. To County and Tribal Health Councils who collaborated with us in curating the programming for these summits, and legislators and other key partners, thank you for formulating the information, how empowering these convenings have been for a lot of folks. We're getting some great feedback. And of course, once again, Representative Allison and our Legislative Health Council champions, thank you for your support. We're here today. County and Tribal Health Councils are here today because of you. And so we want to take a quick little poll. We would love to hear from each and every one of you, if you would be interested in joining our advocacy efforts as we enlist the government to establish reoccurring optimal funding in support of health councils so that they can excel, succeed in service of community members across the entire state. We really appreciate your partnership on this. You can find also more information about your legislator at this link here, and we'll share the slide deck as well, and more information about all the ways in which you can join advocacy efforts at the New Mexico Alliance in support of county and tribal health councils. And as we conclude with today's summit, I want to extend my heartfelt gratitude to each and every one of you for your presence, your wisdom, your dedication, and for your active participation and invaluable contributions. Your passion and insights and commitment have made this gathering a success. We have learned about the important work of health councils, shared and explored some innovative solution-driven ideas, made new connections, and reaffirmed our unified goal to improve the health and well-being of our communities. The alignment between legislative, government, and health council priorities has never been stronger, and also with our state agencies. And I believe that together we are so well poised to create lasting, positive, and meaningful change. So let us carry the energy from today and inspiration from our time together into our daily work. We have the power to transform our vision and goals into reality and build a healthier New Mexico and a more equitable future for all. So thank you once again for being here, and let's continue this important work with renewed vigor and drive. We look forward to our collaborations with you. Thank you. Take good care.